Welcome back. Today we're exploring a surprising health indicator, your tongue. This small muscle does more than help you taste and talk. It can reveal early signs of internal health issues. Doctors often check the tongue first during exams because it can show problems before other symptoms appear. We'll break down what changes in color, texture, and coating might mean for your health. This isn't about self-diagnosing, but about being more aware of your body's signals. Grab a mirror, say ah, and let's see what your tongue might be telling you. Let's start with color. The color of your tongue can be surprisingly informative about your overall health. It's a quick and easy way to get a glimpse into what might be going on inside your body. A healthy tongue is usually pink with a thin white coating. This coating is normal and helps to keep the tongue moist and protected. It shouldn't be thick or discolored. Think of it as a natural part of your tongue's ecosystem. If your tongue looks pale, it's a sign that something might be amiss. It could signal anemia. Your body isn't getting enough oxygen-rich blood. Anemia can leave you feeling tired, weak, and short of breath. It's important to get it checked out by a doctor to determine the underlying cause and get the right treatment. This could involve dietary changes or supplements. A bright red, smooth tongue. This is sometimes referred to as a strawberry tongue because of its appearance. That might mean you're low on B vitamins, which are essential for many bodily functions, like B12 or folic acid. These vitamins play a crucial role in nerve function, red blood cell production, and DNA synthesis. A deficiency can lead to a range of symptoms, so it's important to address it. Sometimes a red tongue can also point to illnesses like scarlet fever or Kawasaki disease in children. These are serious conditions that require prompt medical attention. It's always best to consult a pediatrician if you notice any unusual changes in your child's tongue. A purple or bluish tongue is definitely something you shouldn't ignore. Is a warning sign for circulation or lung problems. Your blood may not be getting enough oxygen. This is a serious issue that needs immediate medical evaluation. It could indicate a problem with your heart, lungs, or blood vessels. Foods and drinks can temporarily stain your tongue, so don't panic immediately if you see a change in color after enjoying a vibrant meal. So consider what you've eaten before worrying. Give it a little time and see if the color returns to normal. If the color change lasts more than a day or two and you can't attribute it to something you ate or drank, it's time to pay attention and investigate further. Color changes often come with other symptoms. It's rare for a tongue color change to be the only sign of a problem, like fatigue with anemia or tingling with B12 deficiency. These accompanying symptoms can provide valuable clues to help you and your doctor pinpoint the underlying cause. The tongue is just one clue. Doctors look at the whole picture, considering your medical history, other symptoms, and test results. Next time you brush your teeth, make it a habit to take a quick look at your tongue. Check your tongue's color. It only takes a few seconds and can provide valuable insights. Is it the healthy pink you expect, indicating everything is likely in good order? Or has it changed, prompting you to investigate further? Noticing these shifts can help you catch health issues early when they're often easier to treat. Your tongue's hue is a simple but powerful health check, a window into your well-being that's always available. Make it a part of your regular self-care routine. Now let's talk about coatings on your tongue. It's easy to overlook, but the appearance of your tongue can actually tell you a lot about your overall health. We're going to delve into what these coatings mean, what causes them, and when you should be concerned. We're going to focus especially on white ones. A white coating on the tongue is a common occurrence, and while it's often harmless, it can sometimes indicate an underlying issue that needs attention. So let's explore the different types of white coatings and what they might signify. A thin white film in the morning is normal. Overnight bacteria and dead cells accumulate on the surface of the tongue, leading to this slight discoloration. It's a natural process that happens to everyone. This normal morning film usually brushes away easily with a toothbrush or tongue scraper. A quick brush is often all it takes to restore your tongue to its normal color. But a thick cottage cheese-like coating is a different story. This type of coating is far from normal and warrants a closer look. A thick cottage cheese-like coating could mean oral thrush, a fungal infection needing treatment. Oral thrush, also known as candidiasis, is caused by an overgrowth of the candida fungus in the mouth. Thrush is common after antibiotics. Antibiotics kill both good and bad bacteria, disrupting the natural balance in your mouth and allowing candida to flourish. Thrush is also more common in people with weak immune systems. Conditions like HIV/AIDS or certain medications can compromise the immune system, making individuals more susceptible to fungal infections like thrush. Thrush can also be more prevalent in those with diabetes, especially if their blood sugar isn't well controlled. High blood sugar levels create a favorable environment for Candida growth. Dehydration can also cause a white tongue. When you're dehydrated, your body produces less saliva. Less saliva means more buildup of bacteria and dead cells on the tongue surface, leading to a white coating. Saliva plays a crucial role in washing away debris and keeping the mouth clean. Poor oral hygiene is another culprit behind a white tongue. Neglecting to brush and floss regularly allows bacteria and food particles to accumulate. Specifically, not brushing your tongue lets bacteria and debris accumulate, contributing to the formation of a white or discolored coating. Sometimes persistent white patches that can't be scraped off are a sign of something more serious. These patches may appear smooth or slightly raised. These persistent white patches are leukoplakia, which can be precancerous, especially in smokers. Leukoplakia is often linked to tobacco use and can develop into oral cancer if left untreated. Context matters when evaluating a white tongue. Consider your recent activities, medications, and overall health. For example, after antibiotics, think thrush as a likely possibility. After a marathon, think dehydration and replenish your fluids. And if you smoke, get checked for leukoplakia regularly by your dentist. Early detection is key to preventing serious complications. Remember, a white tongue is rarely just one thing. It's often a combination of factors contributing to the discoloration. So look at your habits and health history to get a clearer picture of what might be going on. Good oral hygiene and hydration usually help resolve most cases of white tongue. But persistent changes need a doctor's look to rule out any underlying medical conditions. Don't ignore what your tongue is telling you. It's a valuable indicator of your overall health. Brush, scrape, and stay alert to changes in your tongue's appearance. Make it a part of your daily routine. Your tongue's coating is a direct line to your health, offering clues about your body's internal state. Pay attention to what it's saying, and take proactive steps to maintain your oral and overall well-being. What about a yellow tongue? Usually it's bacteria and dead cells building up, often from poor oral hygiene, dehydration, or mouth breathing. Some mouthwashes or foods can also cause yellowing. Sometimes yellow is the first stage of black hairy tongue, where papillae grow long and trap debris, harmless but unsightly. Rarely, a yellow tongue can signal jaundice from liver or gallbladder issues, especially if your skin or eyes turn yellow too. If that happens, seek medical help right away. For most, better brushing, scraping, and hydration clear up yellow tongues. Cut back on staining foods and drinks and quit smoking if you can. If yellowing persists or comes with other symptoms, see your doctor. Your tongue's color is a clue. Don't ignore it. Notice cracks or grooves on your tongue? That's called a fissured tongue. For most, it's harmless. A normal variation, like freckles. The main issue is hygiene. Food and bacteria can get trapped, so brush your tongue gently. Sometimes fissured tongues are linked to conditions like Down syndrome, Melkerson-Rosenthal syndrome, or psoriasis. Dehydration and B vitamin deficiencies can make fissures more noticeable or sore. Geographic tongue, red map-like patches, can appear alongside fissures and is also harmless. If cracks are new, painful, or come with other symptoms, get checked. Most of the time, it's just a unique feature needing extra cleaning. Keep your tongue clean and watch for changes. Fissures are usually nothing to worry about, but stay aware. What if your tongue is smooth, glossy, and sore? That's atrophic glossitis. It means you've lost the tiny bumps, papillae, on your tongue, often from iron or B vitamin deficiencies. This can make eating painful and worsen nutrition if not addressed. Celiac disease and Sjogren's syndrome can also cause a smooth tongue by affecting nutrient absorption or saliva production. Burning your tongue on hot food causes temporary smoothness, but atrophic glossitis is persistent. If your tongue is smooth and red, see your doctor for blood tests. Treating the deficiency usually restores your tongue's normal texture. Don't ignore a smooth, sore tongue. It's a strong signal something's missing. Early action can prevent bigger health problems. Your tongue's texture is a vital health clue. A swollen tongue, macroglossia, can be alarming. It might feel thick, look scalloped, or even make speaking and eating hard. Sudden swelling with breathing trouble is a medical emergency. Think allergic reaction. Infections, injuries, and vitamin deficiencies can also cause swelling. Chronic swelling may point to hypothyroidism, acromegaly, or rare conditions like amyloidosis. A scalloped tongue can also signal sleep apnea or jaw issues. If swelling is new, severe, or comes with other symptoms, seek help fast. Persistent swelling deserves a doctor's attention. Your tongue's size can reveal urgent or chronic health issues. Don't wait if you notice sudden or ongoing changes. Tongue pain is hard to ignore. It can disrupt your meals, affect your speech, and generally make your day a lot less pleasant. The tongue is a sensitive organ, and when it hurts, you definitely know it, and can have many causes ranging from minor irritations to more significant underlying health issues. Pinpointing the exact cause can sometimes be a bit of a puzzle. The most common is trauma. Biting, burning, whether it's from that too hot coffee or an accidental chomp while you're eating. These everyday mishaps can leave your tongue feeling sore and tender, or irritation from dental appliances. Braces, retainers, or even dentures can rub against the tongue, causing discomfort and sometimes even small ulcers. Infections like thrush, characterized by white patches, canker sores, those pesky little ulcers that appear for seemingly no reason, or oral herpes can also cause pain, often accompanied by blisters and a burning sensation. Sometimes pain comes from inflammation, making your tongue feel swollen, red, and extra sensitive. Due to vitamin deficiencies, particularly B vitamins or iron allergies, which can trigger inflammation and a host of other symptoms, or irritants like alcohol and tobacco. These substances can irritate the delicate tissues of the tongue, leading to pain and inflammation over time. Burning mouth syndrome causes pain without visible sores, a frustrating condition where the tongue feels like it's burning, even though it looks perfectly normal, and can be linked to nerves, hormones, or stress. The exact cause is often unknown, making it difficult to treat. Rarely, persistent pain or a sore that won't heal despite your best efforts could be oral cancer, especially if it lasts over 2 weeks. Early detection is key in these cases. Warning signs: persistent sore, lump, anything that feels unusual or out of place, red or white patch that doesn't go away, unexplained bleeding or pain when swallowing. These symptoms warrant immediate attention. If you have these, see a doctor or dentist right away. They can properly evaluate your condition and recommend the appropriate treatment. Diagnosing tongue pain means looking at your habits, health, and symptoms. A thorough examination and detailed history are crucial. Sometimes it's simple, like identifying an irritating food. Sometimes it's serious, requiring further investigation. Don't ignore pain that lingers or worsens. It's your body's way of telling you something isn't right. Your tongue's discomfort is a message. Listen to it. Pay attention to the signals your body is sending you, and seek professional help when needed. Your tongue is more than a muscle, it's a health messenger. Color, coating, texture, and size all offer clues about your well-being. Make tongue checks part of your daily routine and don't ignore persistent changes. When in doubt, consult a healthcare professional for answers. Stay curious, stay healthy, and keep listening to what your body is telling you.